Welcome back to the show. Today, we are stripping away the complexity of human anatomy to talk about something foundational, the geometric planes of the body. Think of it as the GPS system for your surgery or diagnostics. It sounds basic, Dr. Khan, but for our students, mastering the sagittal, coronal, and horizontal planes is non-negotiable for board success. You cannot interpret a CT or MRI if you cannot visualize these sections in your mind. Exactly. Let's start with the median plane. Imagine slicing a human right down the center, nose to belly button. That perfect midline split. Clinically, why does this matter? Well, think about a midline laparotomy incision. If you are not perfectly oriented, you are not finding your landmarks. And remember, on the boards, they love to distinguish between the median and sagittal planes. The median is specific to that center line. Any plane parallel to the median is simply a sagittal plane. If a question describes a slice through the arm, it is sagittal, not median. Great distinction. Now, what about the coronal plane? Think of it like a crown. Literally, it divides the body into front and back, anterior and posterior. It is like being sandwiched between two panes of glass. A high yield point there. The coronal plane is sometimes called the frontal plane. If you see frontal on a step 1 question, don't freeze. It is the same thing. This is crucial for viewing structures like the heart chambers or the kidneys in imaging. Let's take that further. Why does the coronal view matter clinically? Think about an ultrasound technician looking for pleural effusions. They rotate that probe to get a coronal view to see the full extent of the fluid accumulation between the lung and the chest wall. If you don't know your planes, you are just pointing that probe at random. I often tell my students to think of a radiologist as a 3D architect. They move through these planes to track pathology. If you have a tumor in the liver, you need to be able to see its relation to the portal vein in a horizontal cross-section, which brings us to the transverse or horizontal plane. The horizontal or axial plane. This is my favorite. It cuts you like a magician's box trick, separating top from bottom or superior from inferior. It is the gold standard for most cross-sectional imaging, like a CT scan. Board exams love to test your spatial reasoning here. A question might show a slice and ask what structure is at a specific level, say the level of the T4 vertebra. You have to know what occupies that horizontal slice, the sternal angle, the bifurcation of the trachea. If you can't visualize that horizontal plane, you miss the question. It is all about spatial awareness. Whether you are a surgeon planning a delicate procedure or just picking your doctor of choice for a consultation, you want someone who understands how these planes intersect. You don't want a surgeon who gets lost in the third dimension. That is so true. It is a language of precision. When we talk about anatomical position, everything is relative to these planes. If a patient is supine, the horizontal plane remains the horizontal plane, but the relationships shift relative to gravity. And that leads into the clinical reality of patient positioning. We don't always operate on people standing up in anatomical position. Surgeons have to mentally rotate these planes in their heads when the patient is prone or lateral. It is like playing 4D chess with a scalpel. And that is why the boards will present images in radiological convention. In that view, the right side of the body is on the left side of the screen. Students get tripped up constantly because they try to map it to their own body instead of the patient's perspective in the horizontal plane. That is a classic trap. Always identify your orientation markers on the imaging software first. Why does this matter clinically? Because if you confuse the left side of the liver for the right, you are doing a biopsy on the wrong side of the patient. That is a disaster. Precision is safety. To summarize for our listeners, the median plane splits the body into equal halves. Sagittal planes run parallel, coronal planes divide anterior from posterior, and horizontal planes divide superior from inferior. Know these, and you have the key to every medical image you ever see. Master the planes, master the body. Thanks for joining us for this deep dive into anatomical orientation.